Okay, so what we're looking at today is this really dry, cracked piece of skin on the side of the foot. So this area up here is just beneath the fifth metatarsal head. So that's the joint behind the fifth toe. So the reason why we do this is, one is because it makes it feel a hell of a lot better, so it doesn't feel like it's grinding and twisting and actually tearing the skin. The other reason we do it is it reduces the chance of infection, because when these cracks get so deep, they'll actually split right down to the living skin, and then they'll actually try and tear the living skin apart, and it can actually bleed and become infected. So particularly if you're in an immunocompromised group like a diabetic, that can lead to infection and amputation. So we do this mostly in diabetics or people that are immunocompromised. So what we do is we remove all the hard skin, try and get down to the bottom of the cracks as best we can. We can't always get all of the crack out in one go, so quite often we might follow this up in 3 weeks of after using a urea moisturizer, so we can actually remove the remaining skin in that crack. And then generally what we find is the crack generally gets better over, the course of about 2 to 3 treatments, and then moisturizer will be enough to maintain it uncracked, as long as the patient is diligent with what they're doing and they can actually apply the moisturizer to their feet, because not everyone can actually reach their feet to apply the moisturizer.